airway, and they make this snoring, sometimes make this snoring noise when that happens, or if you're unlucky, you don't make any noise at all. So if you squash your head down like that, and you can feel, because with the kids we say cheesy Wotsits as loud as you can.
Cheesy, oh yeah, cheesy Wotsit, yeah.
Right, now put your head right back and say cheesy Wotsits.
Cheesy, yeah, cheesy Wotsits. It's like being back in the supermarket as a kid when you used to make a noise. You put your head back and shout as loud as you can.
Yeah, so what we can do is we can tilt the head back. As first responders, we've got extra equipment that we can use to help with the airways. And in here, we should have, here we go, we can insert one of these, and we can put one, we can measure it up, insert in one of these, and that will lay in the back of the mouth, and the tongue will lay there, so it keeps the tongue away and keeps the airway clear. So we're trained as responders, we can actually, I can't fit one into the dummy, but I can get one of those airways in to help the airways if need be. So that's what we can do for A. Next we need to do B, which is breathing. We need to check how the patient's breathing. It might be by tilting the head back, they suddenly gasp for air. But if they don't, then we tilt the head back, and then we look, listen and feel. So we look along the chest, we feel the chest, and we listen, and we can feel the breath on our cheek. We do that for 10 seconds, which, if in real life, is an exceptionally long time.
Yeah, it must feel like forever.
One. So we count for 10 seconds, and in that 10 seconds, we're looking for 2 to 3 good breaths.
Okay.
In this scenario, we're going to say that there was no breaths.
With the chest, are you just touching that because you want to see if it's going?
I want to feel to see if I can feel any movement on there. Yes, and we listen to hear for the breaths. We're also listening for any noises. If they are breathing, we're listening for certain types of noises for certain different conditions. But in this case, we're going to say that the patient wasn't breathing. If they had been breathing, the next thing we would do is we'd put them into the recovery position. I don't know if anyone remembers doing this, where you
Scouts.
Yeah, where you
Scouts.
even if you can't remember exactly how to do the recovery position, just get them on their side. It's the safest place they can be. As long as their bum is higher than their head, then if they vomit, and the vomit will come away, and it will also help keep the tongue away from the back of the throat. So roll them onto their sides. Like I say, don't worry if you can't remember exactly how to do it. There isn't a proper way of doing it, but if you can roll them on their sides, just keep their airways clear. But in this case, we're going to say it's not. And now we're going to show you how to use the defibrillator. Because as a first responder, the next thing we're going to do is we're going to, if they're not breathing, even if, because some people say, well, don't we need to check for a pulse? If they're not breathing, then their heart isn't going to keep going for much longer. So as a first responder, we move straight on to the defibrillator. And that's this. So if you want to open up the defibrillator, you can do that.
Wow.
In the meantime, while you're doing that, I'm going to connect up the oxygen.
This is quite scary, because you actually feel like you come to realise that actually someone's life's in your hands.
Open package and remove pad.
Scared the life out of
Open package and remove pad.
Oh,
hello.
I haven't got a pocket.
Can I do this?
Open package and
so
remove pad. Seal one pad from plastic liner.
Tear along dotted line.
Tear along the dotted line.
Peel one pad from plastic liner. Peel one pad from plastic liner. Place one pad on bare upper chest.
So peel one pad.
Place one pad on bare upper chest.
Can you make him go back? Or does he just
Place one pad on bare upper chest. Peel second pad and place on bare lower chest as shown.
So it's talking you through what you need to...
Peel second pad and place on bare lower chest as shown.
I don't want to
Do not
damage it
touch
anyway.
patient.
Okay.
Analyzing rhythm.
I see what you're doing.
So if you put one, it even shows you on there.
Analyzing rhythm.
So there's two of them, is there? Oh, okay, so one either.
Right, so it even shows you on there where they need to go.
So I'm going to put it exactly how it is on that.
Oh, there's your control. Yep, so perfect, yeah, if you just
About
press.
there?
Yeah.
Lovely. And then this one goes on the other side,
on the
does
other
it?
side, yeah.
That scared the life out of me when they started talking at me. Right.
I'll get the oxygen ready.
Does it matter what? If it goes the right way up, is that the right way for it?
That's fine. Lovely.
So what exactly does a defibrillator, I can't even say it properly, defibrillator do? What does it do to the body?
What it's doing is it's going to put an electric shock through the patient. Basically what happens in a heart attack is in certain conditions, the ones which we can actually shock the patient out of. If you can imagine, a heart attack doesn't actually necessarily stop the heart. The heart sort of does, it doesn't do its normal beat. So if you can imagine that the normal rhythm of the heart is sort of like ba-dum, 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 yeah. When in a heart attack, what happens is it sort of gets all confused. Imagine two rowers in a boat, and let's say they've had an argument and they're just rowing randomly all over the place. Yet the boat doesn't move, does it? Doesn't move forward. What the defibrillator does is it almost shouts at those rowers and says, right, just cut it out, you two, and just get your act together. Right, 1, 2, 3, row. Yeah, that's what a defibrillator does. So the heart's doing this because it's lost control, and what the defibrillator does is it shocks it into stopping and then starting again.
So it's almost like a reset?
Yeah, like Alt Control Delete on the computer. It just sort of says, right, no, stop, everything's going wobbly, right, we'll put a shock through it and we'll start again. So I stopped it because it was racing ahead of us there.
Yeah, no, it was getting a little bit extreme. Can you tell that to go back, or are you normally quite quick with it anyway? I'm going to make it, in the real ones, it would know that which bit you've done. So we've done the removing the pads. We've got the oxygen mask ready. So we'll use that in a minute.
Tear open peel one pad from plastic liner. Place one pad on bare upper chest. Peel second pad and place on bare lower chest as shown.
So as you can see, it's gone and
What about if they've got like
peel
chest hair?
second pad and place on bare lower chest as shown. Do not touch patient.
Right, we don't touch the patient. It's analysing the rhythm of the heart. So it's trying to work out whether it's one of these wobbly heart rhythms so it can shock.
Shock advised.
It's saying that shock's advised. So what we need to do is keep the oxygen away.
Stand clear.
We say, everyone, stand clear, please.
Shock.
Shock in.
Stand clear. Shock delivered.
Shock's gone through the patient, now it's safe to do CPR. Right, and I'm going to show you how to do this.
30 compressions.
Give 30 compressions.
So
what you need to do is link your fingers together like that. Nice straight arms.
Right.
And we're looking for in the middle of the chest, and we're using this part of our hand. So, because the idea is we need all the pressure to come through this part. Put your weight over the patient, and we're looking for 30 chest compressions. And it's 100 per minute, at the rate of 100 per minute, so it's 1, 2, 3, 4. We're looking for about a third of the depth of the body. So if you've got a particularly large patient or a particularly small patient, you're still looking for a third of the depth. The rate is about 100 per minute, about 100 per minute. And so if you wanted to know off the top of your head, I mean, who knows what 100 per minute is? Yeah. It's Nelly the elephant. Okay. So if you go, Nelly the elephant, back to trunk and say goodbye to the circus, you've got about the right rate. Yeah,
I hope you don't do that.
Don't say it out loud. Yeah, that would be a bit worrying. So you do 30 breaths, 30 chest compressions, and then 2 breaths. And we tilt the head back, and we go. Did rise, didn't it? Yeah. 2 breaths. We've got oxygen attached to help give more oxygen into the patient. So yes, do you want to give it a go?
I'll give it a go. I don't know if I'll be any good or not. My rhythm's terrible. Right, so about a third of the way down, about there then, yeah?
Yeah, so in the middle of the chest, so in the nipple line, in the middle.
Pull all the jewellery out of the way, about there?
Yeah, nice straight arms, and put your weight over. You should be able to get quite a nice, it should be just a rocking motion to
so
get...
like 1, 2, Is that too fast, or is that Nelly the elephant?
Nelly the elephant. So jump and say goodbye. That's brilliant.
Give breath.
Oh, how many have we done? Have you counted?
Stop CPR.
Brilliant.
Do not touch patient.
Right, so...
Analysing rhythm. Do not touch patient. Analysing rhythm.
He's done damage, isn't he?
Shock advised.
Right, okay, so what you need to do is check the oxygen's away.
Push flashing
button. Right, so tell everyone to stand clear.
Stand clear.
Okay, check no one's touching the patient.
Push flashing button to deliver shock.
Yeah. That puts the shock through the patient, and then you go straight back on.
To touch the patient.
How many times to do that?
You've got chest compressions. Just keep going.
Really?
30 chest compressions, 2 breaths, and just keep going. And the reason we like stop is If we're getting tired and there's somebody else trained to do so, they'll take over. Because obviously if you keep going, and then obviously your technique will get weaker the more tired you get. So we try and get somebody else to swap in if we can. If the patient starts coughing and saying you get off, or you get off, then that's really good.